Welcome, everyone. My name is Dr. Melanie Carminati, and you are tuning into the Know and Do Better podcast, where we chat with experts on a variety of different health, wellness, and holistic topics. Today, we have the pleasure of speaking with Dr. Sera Lavelle, who specializes in weight loss, eating disorders, trauma, and relationships. And we will be chatting about hypnosis and psychotherapy. Hello, Dr. Lavelle. I'm so thankful for the opportunity to speak with you today. Thank you for being here.
Thank you so much for having me. I'm very honored to be chosen to speak about my favorite topic.
Yes, me too. So just a brief background for everyone who's listening. Dr. Sera Lavelle is a clinical psychologist, an expert in using hypnosis and integrative therapy for weight loss, eating disorders, anxiety, depression, infertility, and relationship issues. She is the owner of her group practice of esteemed psychologists at NY Health Hypnosis and Integrative Therapy, and will soon be launching her revolutionary app, Be a Better Eater, which uses AI paired with mindfulness to help people change their relationship with food. Dr. Lavelle has been featured in Forbes, Elle Magazine, and Allure, and helped hundreds of people overcome their difficulties. She has served as an adjunct professor of psychology at Adelphi University and Brooklyn College, where she taught courses such as psychology of gender and sexuality and cross-cultural psychology. And she is particularly interested in how these issues affect people individually as well as societally. So thank you again. I wanted to just start off the conversation with understanding, when did hypnosis become integrated in psychotherapy? And was it integrated elsewhere outside of the US, like other parts of the world, before we saw it here in practice?
It's such a good question because hypnosis actually predates psychotherapy. I've always found it fascinating that actually Freud started with hypnosis and working under Brewer, and he actually rejected it. He felt like it was too
Wow.
seductive. So he actually developed his entire theory of psychoanalysis based on getting to the subconscious using any means possible other than hypnotherapy. A lot of debate as to when it started, but we kind of have these vague notions of like Mesmer, Heisiger, and these people that have been around for a lot longer. Hypnosis back then was really used a lot of times to help people relax, but also a lot for pain management. Things have kind of gradually tipped away as we got more reliant on medications. People stopped using hypnosis for pain, and then once Freud actually took off with psychotherapy, his whole theory of psychoanalysis, people started moving away from hypnosis into these other realms. And then kind of throughout that time that these other forms of psychotherapy got more popular, people began integrating hypnosis back into it.
Interesting. What would you say, and I guess we can speak specifically since you said pain was the initial use for
Mhm.
hypnosis primarily?
Yeah.
So the goal would be
Mhm.
to decrease the pain and to help manage the pain. But is there an overarching theme for hypnosis, or is there an overarching goal?
Well, there's a lot of different goals the way we use it in modern times. One of the main reasons people stopped using hypnosis, back, even before Freud, was with the invention of ether. It used to be that hypnosis was kind of the only way to operate on a person.
Mm,
And then once these other things came, very effective, but a lot of side effects, it kind of weaned that out. But then Freud actually started using hypnosis with Brewer to treat women back then suffering from what he'd call hysteria.
mhm.
Right. So, hysteria is like, you think of, a hysterical woman, but really it means like kind of phantom arm pain or phantom, passing out, like these kind of weird, unexplainable symptoms that tend to be more psychological.
Mm.
Hypnosis now is a lot more commonly used. I tend to find when people are very stuck in psychotherapy, it's this really good way of pushing people forward. I feel like it puts the power back in a person's hand. And
Mm.
the whole idea behind it is people are ambivalent. Say you do have an eating disorder and or just a problem with weight, but it's a lot more psychological. So you tell yourself, I'm not going to eat donuts today, or I'm not going to eat pizza today. And then something comes over you and you feel compelled to do it. Hypnosis can kind of be used to help you become more aware of your own desire to change. Contrary to the popular misconception, hypnosis can't make anybody do anything they don't want to do. However, it allows people to do things that they want to do that they've somehow felt stuck from being able to do.
How do you handle that skepticism of, oh, if I go to hypnosis, it's going to have me do something, it's going to be controlling me or
It's
something of that?
really hard,
Yeah.
it's so I try to explain to them that what they see on TV is very different than what we practice, and that it's not even something that we really do. Hypnosis really falls into these two main realms.
Mhm.
stage hypnosis and hypnotherapy.
Okay.
Stage hypnosis is more like a party trick. You know, if you really look, you know, we have this image of this almost like magician like person that says, quack like a jaw, close your eyes. I think only about 5% of people could be hypnotized that way. And I
Mhm.
wouldn't even call that hypnosis because it's so different than what I do. What we practice is something called Ericksonian hypnosis, and you're going to get a lot of training in it. And it's the use of language in order to help a person get into a relaxed state,
Mm.
very similar to meditation, where they can really focus on what it is that they want to change. So I don't consider it that I'm hypnotizing anybody the same way that a reading teacher isn't making a person read. They're teaching you how to read, and I'm teaching a person how to relax. So it's not really that, like, oh, I can't be hypnotized. It's can you get into a relaxed state? And a hypnotic state is not something that we don't attain naturally. So really a hypnotic state, it's a deviation from the term hypnagogic, which means the state in between asleep and awake. But not only that, you know, if we're daydreaming during the day, that's a hypnotic state. If we are immersed in a really good book or movie, that is a hypnotic state. It's any time that we kind of are a little bit zoned out, but it's not so different than everyday life. So when I think of the skepticism, I think they're skeptical of the same things that I'm skeptical. And
Mhm.
it's because they have a misconception about what hypnosis is, and they have a right to have a misconception because it's been portrayed so poorly.
Where would those other forms of hypnosis, like where does that fall? Because it's clearly not clinical, I guess we could
Mhm.
say. It's where does
Yeah,
that
it's
fall?
clearly not clinical. So there is a stage hypnosis, right? Which that is when it's a performer,
Okay.
right? So we have kind of a loose image of that. But then I do think there are a lot of people as well. There is kind of even within the mix of like helping people. There are some people who go to only professional hypnosis
Right.
academies, right? Like the
Mhm.
American Society for Clinical Hypnosis is a fantastic organization. It's nothing but licensed mental health practitioners. It's not open to the general public, and they're very into promoting the ethical and appropriate use of hypnosis. There are training programs that are just you're a hypnotist and they'll teach you how to get a person to quit smoking. But without the training in mental health, I don't at least think it'd be hard to practice it ethically and have an understanding of, hey, you know, well, what if this person quit smoking, but they're actually depressed? How can you address one but not the other? I really think you need both pieces to kind of like deal with the underlying issues and then use hypnosis to propel a person forward.
Hypnosis is tapping into that subconscious.
Mhm,
So let's chat a little bit about the subconscious thought
mhm,
patterns that we have and how do we play a role in those subconscious thought
mhm.
patterns and how do they form in the first place?
So subconscious thought patterns are an entire lifetime of programming,
Right.
right? Like I often give people the analogy of patients will say, well, that was 30 years ago. Why should this still affect me now?
Mm.
And I try to tell them, well, if you built a house with tools that weren't really working, the
Mm.
foundation would still be kind of shaky, right? So even though you relearn things, you might not believe them. Or speaking specifically, I know you had mentioned trauma.
Mhm.
A lot of people think cause and effect. You know, something horrible happens and
Right.
they're damaged from the event. A lot of times, what you're damaged from, even more than the event itself, is what you believe about it. For
Mhm.
instance, if somebody was sexually violated as a child and they were taught by their parents, hey, this is wrong, we've attacked this person, this had nothing to do with you, they might not be as affected by that trauma. Now, if that similar child had a very similar trauma and they were made to believe that this happened to them because they were dirty or they were disgusting or they encouraged it in some way, it's how they make sense of it that can last throughout the rest of their lives. So we don't do hypnosis in our practice. There's something called age regressions, which means you take somebody kind of back to an earlier time. The research on it is very mixed, so we don't really approach it in that way, but we can say on a conscious level, this is really horrible what happened to you. Let's use psychotherapy to kind of process everything. And let's then use hypnosis as a way to visualize feeling whole and feeling clean and feeling good. So
Yes.
you wouldn't necessarily use it to take the person back to that memory, but you can use it to maybe undo some of the damage combined with the psychotherapy.
Yes. Yes. Absolutely. I can speak in regards to trauma as a physical therapist,
Mhm,
just seeing how the cause or the trauma, how it manifests in
mhm,
so many different ways,
mhm,
myofascial restriction, pain, different regions of pain, and from the visceral manipulation work too, and the craniosacral therapy, it's
mhm,
really profound. Our bodies our bodies are resilient and they have
Mm-hmm.
an innate ability to heal, but
Mm-hmm.
there has to be that processing. I like how you explained that we have the whole tape, we
Mm-hmm.
have years and years of the subconscious programming. It's just in there.
And sometimes the maladaptive programming is actually trying to keep you safe.
Mhm.
It's just hardwired in the wrong way,
Yeah.
right? Say you grew up, and again, going along with this trauma, you learn to never trust partners again, right?
Mhm.
We would say, okay, well, that's a bad thing. They don't trust anybody. But on the other hand, sometimes you should thank yourself for it before you let it go, because it's your unconscious mind trying to keep you safe. It's just about relearning that that might have been a rule that you needed to learn to keep yourself safe as a young child, but now we need to unlearn that rule.
In order for that mindset shift to take place,
Mhm.
does the subconscious reprogramming have to happen first?
Well, I think a lot of things are chicken or the egg. Even with hypnosis, say going off the trauma, say something behavioral. A lot of people will say things like, "I want to use hypnosis to quit smoking.
Right.
So please make me not like it anymore. Please make me not crave it anymore."
Mhm.
Well, you have already attached a chemical to your nicotinamic dopaminergic receptor, and you are chemically, physically addicted. So, no hypnosis in the world can make you not be addicted. However, I can use hypnosis to make you stop anyways, or help you realize how important it is, and then help you stop, knowing that if you stop long enough, you'll automatically relearn. There's very few people who haven't smoked for a year and thought, wow, I wish I was still smoking. But when you're in it, you feel like you'll always miss it. So can you then, going back to trauma, you need to solve what happened before you could like yourself, or could learning to like yourself actually help you look back at it differently? And I think it works both ways.
So we mentioned so far trauma, smoking. What other
Mhm.
conditions or psychological challenges would benefit from hypnosis?
The main one that I work with is eating disorders. My main area of specialty is working with binge eating and bulimia. And, this is a lot of people come to me because traditional psychotherapy hasn't worked enough for them. And
Mm.
so a lot of people think of these disorders as being teenage disorders, but I work with people 30s, 40s, 50s, 60s, and 70s who might have been bulimic for 50 years,
Yeah.
right? And it feels like this compulsion,
Mhm.
right? And I think after doing something for so long, what happens is you get better at hiding it. But in that process, you convince yourself that you could never change, that
Mm.
this is just who you are. I think something about doing hypnosis, when you really help a person focus on in a meditative state, how much they want to change, they're able to carry that with them a lot longer, right? It
Mm.
takes away this disease model and focuses more on what you want to change than what your diagnosis is. Not
Mm.
that we don't give diagnoses or that we think it's a very important tool, but there's a lot of reframing in hypnosis, right? So, for instance, you're using the art of language to undo things. And the first thing you'll learn in hypnosis is that the way you speak about things is the way you think about things. So, my first goal in working with eating disorders is to change somebody from saying something like, a binge happened last night, to, I was upset and I ate so much I felt physically ill. Because if a binge happened, I can't get a person to stop something that happened to them. I can help them stop something that they're doing. But the problem is, it's hard to say, I did this last night, because it's painful. So you're really using the language, asking them, what is it that you want to stop doing? And trying to find any way of getting in there. Like any way to find a glimmer of hope that you can amplify.
That's beautiful.
Thank you.
Shining the light, shining the
Yeah.
light on those bits of hope that are there.
Yeah.
So, in your experience, eating disorders, are there any others that
Mhm.
benefit the most from hypnosis?
Absolutely. Within our practice, we have a lot of specialties,
Right.
and a lot of our other therapists work on different things. So, one of our therapists works a lot with addiction. He
Mhm.
was a clinical director of some of the biggest addiction clinics. And, another one of our therapists is really the expert in insomnia. She's worked with veterans who were going through PTSD.
Sure.
Another one of our therapists uses hypnosis for trauma
Mhm.
specifically, and helping people heal from that. Another one of our therapists specializes in chronic pain. It's also yet another one of our therapists really uses hypnosis in this beautiful way in relationships. to help a person overcome their fears of intimacy and help them bond as a couple. So there are a lot of things that it could be used for. It just with any specific thing you do, you're going to be integrating the appropriate psychotherapy techniques coupled with the hypnotic techniques. Right? It's never going to be enough to say, okay, I'm going to hypnotize you to be able to sleep again.
Mm.
It's going to be okay. Well, are you watching TV until midnight? Are you anxious all day? Are you doing these different things? Okay. So we will approach all these different problems and then we'll use hypnosis to kind of amplify what we're already doing in therapy.
Can you speak on what the research is showing long term for benefits
Mhm.
for individuals who
Mhm.
utilize hypnosis in their
Mhm.
psychotherapy?
Yeah. So there's tons of research on hypnosis as an adjunct to therapy. And, there's a lot of different studies I could quote, but there are studies almost within every realm that I mentioned. For instance, smoking cessation is considered by the AMA and the APA the most effective form of helping a person quit smoking. So you have things like Chantix, which I think only has a 40% effectiveness rate in hypnotherapy is, 60 to 70%. And yet Chantix has side effects, night terrors, anxiety, hypnosis. The worst thing that could happen is it wasn't as effective as somebody liked. But, even on the psychological exam for people wanting to be licensed psychologists, it's actually listed as what is the best option for treating smoking cessation. And hypnosis just is the answer.
Ah.
There's a lot of research on hypnosis for depression. There's a lot of research on hypnosis for anxiety. Again, for instance, CBT coupled with hypnosis is a lot more effective than CBT alone. There is a lot of research on insomnia, right? And again, the research tends to be CBT compared to CBT plus hypnosis. And the combination of the two almost always come out as more effective than one alone.
So it's almost as though it amplifies they work
Mhm.
together. It's like a
Mhm.
complement and it amplifies the
Mhm.
results.
Yeah,
Mm.
absolutely.
When you're working with your patients, I know as a physical therapist, we give home exercises.
Mhm.
In terms of hypnosis, is there a
Mhm.
home component? Is there a self hypnosis component, or how does that work?
Yeah, I tailor it a lot to my specific patients.
Yeah.
But I personally give my patients a lot of reading, depending on what they're hoping to address. Some people, I do teach them a specific self-hypnosis technique, which is a visualization paired with a kind of a chant. So it's a little bit more like meditation plus that
Mhm.
they can use. And that alone could be powerful to know that, hey, I'm having an anxiety attack right now, but I have this tool I can use. Sometimes you find that you don't even need it, knowing that you have this thing that you can use. Some people, I do recommend that I think things like Calm and Headspace are a great supplement to doing hypnosis. They're more meditation based, but there's so much overlap between meditation and hypnosis. Some people would even say that they're just different forms, or they might even say they're the same thing. So I think anything a person can do in between sessions that's going to help them, I'm going to be open to it. My role as being more of a vessel to help them figure out what is going to work the best for them.
Amazing. So before we dive into future and where you see hypnosis going, do you mind if we chat about meditation some more?
No, not at all. Yeah, that sounds great.
So I've myself have been practicing meditation for 7 years.
Mhm.
And I know from doing chanting, chanting different
Mhm.
Sanskrit
Mhm.
phrases and just going through all of the Zen meditation
Mhm.
experience, that it definitely brings you to a certain kind of state. So I'm just curious as to how that state, how it compares to the hypnotic state.
Mhm.
Some say it's one and the same. The
Mhm.
same that act being able to access that subconscious or that deeper. For me, when I'm meditating, it's almost as though I'm accessing that deeper self and that deeper awareness and just sitting in that seat of awareness.
It's absolutely what it is. There's different ways to conceptualize. Again, Dr. Yapko writes a wonderful book just called Mindfulness and Hypnosis. And he talks about, the Venn diagram where the two of them overlap. I think there are many routes to accessing that state. I think, psychoanalysis could be one. I think meditation could be one. And hypnosis is another. The two are very similar. I think of them, at least the way I conceptualize, is that they are the same state, but that hypnosis is meditation plus some kind of call to action. So the point of meditation would be just to get into a relaxed state, The point of hypnosis would be once you're in that relaxed state to use language to try to do some, not quite reprogramming, because again, that makes it sound like that, we're tinkering around in there, but using hypnosis to make a person very aware of what they want to change while they're into that state to the point that they feel very compelled to change it and they feel like it's possible to change it.
I know for myself that I've somewhat improvised in some of these ways when I'm in that meditative state. So it's good to know how
Mhm.
you conceptualize the two.
Mhm. Yeah. There's also different forms of meditation. Some meditation, you're going to want to have a very clear mind
Right.
and try to like very focus and
Mhm.
not think about anything else. But some of my really anxious patients, that can be really frustrating for them. And
Mm.
eventually they might get there, but sometimes they'll give up before they do that. Now,
Mhm.
guided meditation is a lot more similar to hypnosis. And a
Mhm.
lot of my patients like the fact that they're guided because they don't have to work so hard to
Right.
try to get into that state. It's like we're kind of guiding them into it.
Yes. And in terms of the meditation, there's inquiry meditation. And
Mhm,
so beyond the pranayama meditation, I know that I typically will start with the breath just to get grounded, and then
mhm,
we'll go into the inquiry of something to investigate and discover what's going on inside
mhm.
myself.
Cool.
So, where do you see hypnosis evolving in the future?
I do think there's an intersection between people are taking their health into their own hand,
Mhm.
and I think technology could be used for good.
Mm.
I actually love that people are doing more meditation apps. I love that people are finding a way to find Zen in the middle of the day. I do think, we have these devices around at all times and that, people do want to come to a greater awareness. So I could see it just becoming more and more popular in a way that's more and more individualized. I do think that it's becoming more accepted. I think that whole idea of this like stage hypnosis, repressed memories, like all the things that kind of scare people about hypnosis, that kind of portrayal of hypnosis really started in the 80s and carried into the 90s.
Mhm.
And people are now starting to conceptualize a little different and putting it more in the meditation and yoga and holistic realm. So I do think there's something where, the average person isn't nearly as skeptical of it as they used to be
Mhm.
because they're able to understand it a little bit better.
Any last words on hypnosis or something you want to share with the viewers and people who are listening and on this podcast?
Yeah, sure. I kind of wanted to talk about the fact, like we do a very specific kind of hypnosis. We do Ericksonian hypnosis, which is the art of using language.
Mm.
Um, I want to let people know there's nothing magical about hypnosis.
Mm.
It's just as an example, when I talk about like not triggering people's resistances, just think right now, if I were to tell you, relax and let your mind wander, you might freeze up, right? So in some ways you disguise that. So as a simple example, instead of telling somebody, let your mind wander, which they might resist against, you might say something like, you don't want to train your mind to stay on track. It's not worth the trip. They'll get an image of train, track, and trip, but without actually listening to the deeper message that you want to let your mind wander. You don't want to train your mind to stay on track. It's not worth it, right? And so that's kind of hypnosis as a nutshell, is giving people these messages that they can take in, but they're not going to kind of want to counter. If
Mm.
I were to say you need to quit smoking, you would freeze up, right? You'd be like, it would remind you of your parents. You'd be resistant against it. But if I were to say, let's focus on that part of you that really wants to quit smoking, there's nothing to resist against. So it really is the art of helping a person break free of their ambivalence because at all times we want to change but we don't want to change. We want to proceed forward in life but we also want to fall back into comfort, and change is scary. But it's an interesting dynamic that somebody walks in your office and says, on some level you need to help me change, and I don't want to, but they came through the door so they do want to change, right?
Mm.
And how do you make them so aware of how much they want to change?
Right.
And that's where the art of hypnosis and the art of language comes in, is
Mm.
helping amplify that realization, the point that they can't let themselves continue without changing if they really want to change.
For the Pilates training, I went through Polestar Pilates, and it's more of a
Oh, cool.
rehabilitative,
Mm-hmm.
comprehensive form of Pilates training. And we spoke about neuro linguistic psychology.
Oh,
And so I know that some of that science is debated, but
mm-hmm.
I can say from my practice and in using those techniques of how to use my voice to cue movement,
Mm-hmm.
what words to say. And, if you want someone to be on their back and lift their hips up into a bridge, you could say, okay, you're going to lift up and squeeze your buttocks and hold it and hold, and hold it. Or you can say, now inhale through your nose, exhale through your mouth, and press through your feet, lift your pelvis up. And it feels totally different when you cue. So I know the power of our words and the power of how you use your voice. So it's seeming, as we're having this conversation, that hypnosis is everywhere in our world. It's
everywhere in the world. It's not so different than people think, right?
yeah.
And what you just mentioned is kind of like the exact is like that, like NLP, Ericksonian hypnosis, like that's exactly what we aim to achieve, right?
Yeah.
If somebody is in pain, there's also a part of their body that's not in pain.
Hmm.
And if you focus on the part of your body that's in pain, you're going to feel like I am in pain. If you focus on the part of your body that's actually quite relaxed, you feel like I am relaxed. Right? So it's a lot about using the language to just redirect the attention, just as you mentioned.
Thank you, Dr. Lavelle. This has been a very fun chat. And thank you, everyone, for tuning in to the Know and Do Better podcast. If you've enjoyed this podcast, be sure to like and follow us wherever you find your podcasts. You can also follow Inspira Physical Therapy and Pilates on our Instagram at Inspira Physical Therapy, and check out our website at inspirapt.com. Be sure to stay tuned for our next episode. Thank you so much, Dr. Lavelle.
Thank you so much for having me.